Hello everyone, welcome to another video lecture of Community Health and Social Work, and welcome to UN College Digital Class. In our previous video lectures, we had discussed on disease, and in these video lectures, we had discussed about concept of disease, types of disease, transmission of disease, and agent factors, host factors, environment factors, natural history of disease, epidemiological triad. We have discussed on that parts, and in this class we will discuss on some other parts of disease, and also we will discuss on control of disease. Means we will discuss on concept of control of disease, how we can control different diseases from occurring or from suffering from different persons or some injuries of some person's life. First we will discuss on risk factors. Where the disease agent is not firmly established, the etiology is generally discussed in terms of risk factors. The term risk factors is used by different authors with at least two meanings. There is two meanings. These are an attribute or exposure that is significantly associated with development of disease, and another one is a determinant that can be modified by intervention, thereby reducing the possibility of occurrence of disease or other specified outcomes. Here the risk factor means the causation of the disease, means which are the reasons behind the disease and what are the factors which are related with resulting or occurring of any disease. And in risk factors there is different types of reasons behind different disease. For example, like for coronary heart disease, there is the risk factors are diabetic, obesity, improper diet, smoking, alcohol. In some cancer, there is also reason behind the cancer is smoking, alcohol addiction, the improper diet, and in sometimes some person meeting with any accidental or road accidents, like if they are not using or they are not following the traffic rules and regulations, they are not using the seat belt, they are not using the helmet, due to different reasons they are suffering from road accidents, and the major factors are behind the road accident is the reasons, and here the risk factor is the cause or the reason which are related with the disease or because of which factors the disease is occurring. In these factors there is the cause and the cause factors and the conditions of the person's health status. Next we will discuss about risk groups. Something for all but more for those in need in proportion to the need. And another approach developed and promoted by WHO is to identify precisely the risk groups or target groups in population by certain defined criteria and direct appropriate action to them. First risk approach. In risk groups, it has been summed up as known as the risk or something for all but more for those in need in proportion to the need. And in essence, the risk approach is a managerial device for increasing the efficiency of health care services within the limits of existing any resources. In risk groups, there is different situations and there is some guidelines for defining at risk groups, and these guidelines are biological situation, physical situation, socio-cultural and cultural situation. And under biological situation, there is age group, for example, infants in low birth weight, toddlers and elderly also, those who are suffering different diseases. And in sex, for example, females in the reproductive age period, they are suffering from different diseases and they are meeting different health issues. Then physiological state, for example, pregnancy, cholesterol level, high blood pressure, due to these risk groups of people are suffering from different diseases. And next is genetic factors under biological situation, like family history of genetic disorder. If they in family if some persons have, for example, diabetic problem, and the children will face that issue also. And other health conditions like physical functioning, unhealthy behavior, and different diseases which are related with biological situation. And second one is physical situation. In physical situation, there is rural or urban slums, living conditions, overcrowding, environment, water supply, proximity to industries. In physical situations, in the rural areas and in urban slums also, people are facing different diseases due to unhygienic condition, and also in some times, in some cases, the people are staying in unhealthy environment. They are not living in a better environment. They are not maintaining their environment hygienic and sanitized, and those who are living in unsanitized and unhealthy environment, unhealthy condition of society, they are suffering from different diseases, and due to different infectious viruses, infectious bacteria, they are suffering from different health issues. In physical situation, it also matters the water supply. In some environment, there is problem of proper drinking water or proper water supply, and also due to some industrial area and some factories or mines area, there is the problem of pure drinking water. The water pollution is a major cause in a industrial or in a factory or mines area. Due to unhealthy or due to impure drinking water, people are facing different diseases, and also they are suffering from different health problems, those which are dangerous situation, and they are suffering from different diseases, and also it's resulting different types of infections also in their health. Next is socio-cultural and cultural situation. In this situation, some factors are social class, ethnic and cultural group, family disruption, education, housing, customs, habits and behaviors, access to health services, lifestyles and attitudes. In socio-cultural and cultural situation, the different factors arises, and different factors resulting different diseases also in social situation. In socio-cultural and cultural situation, there is major factor is lifestyle or habits, because of some bad habits, like some have habits of chewing tobaccos, using smoking, alcohol addiction, and these are the bad habits, and they are maintaining the lifestyles in a wrong way, and they are taking improper diet, improper nutritious food, through which they are suffering from different diseases which is related with socio-cultural situation or cultural situations. Modern epidemiology is concerned with the identification of risk factors and high risk groups in this population, and it helps to define priorities and points to those most in need attention, and the knowledge of risk factors and risk groups can be used to prevent disease in so far as we are able to remove or minimize the risk. Through know about the risk groups and risk factors, we can prevent different diseases, and also we can cure, or we can know about different risk factors, different signs and symptoms which are related with which disease, and through which we can contact or appoint the doctor at the right time, and we can prevent the diseases from our society. So we have to know about the risk groups and risk factors which are related with different diseases, because different diseases have different signs and different symptoms, as like different risk factors also, and we can know about the risk groups, because in our society some specific risk groups, like in some specific age group, people are suffering from some specific diseases, and female persons are suffering from different diseases, and in childhood period they are suffering from different diseases. So we have to know about the perfect risk groups who are suffering from different diseases, and which group of people are suffering which disease. Next is spectrum of disease. In spectrum of disease, it is a graphic representation of variations in the manifestation of disease. It is akin to the spectrum of light, where the colors vary from one end to the other, and but difficult to determine where one color ends and the other begins. In spectrum of disease, it is very difficult to know about the determine or to know about the disease, and it is difficult to know about different reasons behind the different disease. At one end of the disease spectrum are subclinical infections which are not ordinarily identified, and at the other end are fatal illness. Sometimes we can't know about different infections which are subclinical infections, and we can't detect at the perfect time, or we can't identify at the right time or at the primary stage of the disease. In the middle of the spectrum lie illness ranging in severity from mild to severe. These different manifestations are simply reflections of individuals' different states of immunity and receptivity. Leprosy is an excellent example of the spectrum of disease. For almost every disease, there exists a spectrum of severity with few exceptions, such as rabies. In infectious disease, the spectrum of disease is also referred to as the gradient of infection. In spectrum of disease, we have to know about the early diagnosis, because in spectrum of disease, we can't detect or identify the disease from the first stage or primary stage. So, at which period the disease is resulting from mild to severe, and some persons are suffering from severe cause or severe stage of that disease. So, we have to diagnosis earlier when we are detecting or when we are identifying some risk factors, or when we are identifying some situations or signs and symptoms of any disease, and at that time we have to contact with the doctor or physician through which we can prevent or cure that disease at that period. Next is iceberg of disease. This is a pictorial representation or a figure representation in which we can know about the iceberg of disease. Disease is related or compared with iceberg. You can see there is a part which is in between the water, and there is another part which is visible cases, and there is a line which is water line. There is a two part, one is invisible part and other one is visible part. And the visible part always seen by the physician, and the invisible cases or invisible parts can't seen by the physician. And this is the asymptomatic infection, and that stage is the clinical illness, and the last stage is death. A concept closely related to the spectrum of disease is the concept of the iceberg phenomenon of disease. And according to this concept, disease in a community may be compared with an iceberg. And in iceberg of disease, the floating tip of the iceberg represents what the physician sees in the community, and that is the clinical cases. And the vast submerged portion of the iceberg represents the hidden mass of disease, and that is latent, inapparent, and also pre-symptomatic and undiagnosed cases and carriers in the community. And the water line represents the demarcation between apparent and inapparent disease. And in some diseases, like for example hypertension, diabetic, anemia, malnutrition, mental illness, the unknown morbidity, that is the submerged portion of the iceberg, for exceeds the known morbidity, and the hidden part of the iceberg thus constitutes an important undiagnosed reservoir of infection or disease in the community, and its detection and control is a challenge to modern techniques in preventing medicine. One of the major deterrents in the study of chronic diseases of unknown etiology is the absence of methods to detect the subclinical state, the bottom of the iceberg. And in this iceberg of disease, the first stage is asymptomatic infection, in which stage we can't know about the disease. We have no symptoms or signs, and we are not aware about any health problems. And second stage is clinical illness. In clinical illness, there is some symptoms and signs of disease. At that time, the physician can see the problem of the patient. And the last stage is death. In death period, that is the last part or last stage of the iceberg of disease, in which period nothing is in hand of the doctor or hand of the physician. Because if we are haphazard, if we are not serious about the clinical illness period, then we are suffering from death. This is the iceberg of disease. Next is concepts of control. In this part, we will discuss about what are the concepts, what are the factors related with the control of the disease, how we can control different diseases. And in these concepts of control, we will first discuss on disease control. And the disease control describes different ongoing or operations aimed at reducing, and these factors are the incidence of disease, the duration of disease, and consequently the risk of transmission, and the effects of infection, including both the physical and psychosocial complications, and the financial burden to the community. These are the factors which are related with disease control. And control activities may focus on primary prevention or secondary prevention. Most control programs combine the two also. And the concept of tertiary prevention is comparatively less relevant to control efforts. In disease control, the disease agent is permitted to persist in the community at a level where it ceases to be a public health problem according to the tolerance of the local population. And a state of equilibrium becomes established between the disease agent, host, and environment components of the disease process. An embodiment of this concept is like malaria control, which is distinct from malaria eradication. In disease control, we have to know about the disease or the incidence of the disease, and also we have to know about the duration of disease, means in which period the disease occurred and at which period we are contact or we are appoint with the doctor or we are discussing with the doctor about that disease. And also we have to know about the cause of the disease, and also we have to know about the infection of the disease and the effects of the infection of that problem also, and through which we can control the disease. And these are the factors which are related with disease control. Next is disease elimination. Between control and eradication, an intermediate goal has been described, which is called regional elimination. It is used to describe interruption of transmission of disease. In disease elimination, this is a elimination of different diseases from our society and describe interruption of transmission of disease, because an interruption means those which factors are barriers for transmission of disease or for spreading of any disease, and when we are contact with the physician and we are getting treatment for prevention or for cure of any disease, then that are the barriers in transmission of disease. And in disease elimination, we can eliminate or we can clear the disease transmission, and we can end the disease transmission through which the disease developed day by day. That is known as disease elimination. Next is disease eradication. In disease eradication, eradication literally means to tear out by roots. Eradication of disease implies termination of all transmission of infection while extermination of the infectious agent. It is reserved to cessation of infection and disease from the whole world. Simply, eradication means tear out or banish the roots, means we have to eradicate or we have to waste the root of the disease or the cause of the disease. And in disease eradication, we can terminate the different risk factors which are related with disease. And in disease eradication also we can completely eliminate or completely waste the reasons which are behind the transmission of disease, through which we can control the disease or through which we can prevent the disease. And we have to clear the roots, because of which root the disease transmitted day by day and the disease developed day by day. And in disease elimination, we can know about the root of the disease, and we can terminate the main reasons and main risk factors which are related with the spreading of disease quickly, and through which we can prevent the disease. Next is monitoring and surveillance. In monitoring and surveillance, there is two terms. One term is monitoring and another part is surveillance. First, we will discuss on the first part, that is monitoring. In major cases, monitoring and surveillance both are the synonyms, but in public health, the monitoring and surveillance is the different factor, and there is some changes in monitoring and there is some other factors which are related with surveillance, which is only in public health, but simply there is the synonym of monitoring is surveillance, which we will discuss briefly about monitoring and surveillance in public health. First, we will discuss about monitoring in public health. What are the major factors, what are the main concept of monitoring in public health? Basically, it is the performance and analysis of routine measurements aimed at detecting changes in the environment or health status of population. In monitoring, it is also refers to ongoing measurement of performance of a health service or a health professional, or of the extent to which patients comply with or adhere to advice from health professionals. In monitoring, it is the stage in which stage we can analysis or we can know about the performance or the routine measurement, in which period we can measure the disease or we can know about the cause and effects of the disease, through which we can prevent the disease. And in monitoring, we can know about the detail about the disease. What are the reasons behind the disease? What are the risk factors because of which the disease transmitted or spread quickly, and through which we can contact or we can interact with the doctor, and we can prevent or cure that disease from the root. Through monitoring, we can do that things. And next we will discuss on surveillance. According to one interpretation, surveillance means to watch over with great attention, authority, and often with suspicion. The main objective of surveillance are, there is three major objectives, and these objectives are to provide information about new and changing trends in the health status of a population, that is morbidity, mortality, nutritional status or other indicators, and environmental hazards, health practices and other factors that may affect health. In surveillance, we can know about the interpretation of the disease, and also the major objective of the surveillance is we can know about the information about different factors, about different agent factors, host factors and environment factors, and also we can know about the nutritional status or health condition of the population, and we can know about the different new and changing trends of the health status, and those programs which are implemented for prevention of different diseases, and through which programs we can know about the different policy and facilities of government which are implemented for prevention of different diseases from our society or eradication of different diseases from our community. Next objective is to provide feedback which may be expected to modify the policy and the system itself and lead to redefinition of objectives. And last one is provide timely warning of public health disasters so that interventions can be mobilized. And another objective of surveillance is we can know about the feedback, and we have to collect the feedback from the beneficiaries through which we can get the data, or we can monitoring or evaluate the data about the disease, and we can know about the detail about the disease, through which we can prevent the disease from the root of cause of that disease, and through which also we can modify in some policy and programs which are implemented for prevention of different diseases, because in day by day there is a need of changes and there is need of modification in different policy. So through feedback we can do that things. Next is Sentinel surveillance. It is a method for identifying the missing cases and thereby supplementing the notified cases is required. This data is extrapolated to the entire population to estimate the disease prevalence in the total population. And the advantages of such a system are that the reporting biases are minimized and feedback of information to the providers is simplified. And Sentinel surveillance agencies could be interested and competent physicians in selected areas to report the cases of disease in their areas. And this system would provide more valuable and detailed information than could be obtained from the traditional notification system. And next we will discuss about evaluation of control. In this evaluation of control, evaluation is the process by which results are compared with the intended objectives, or more simply the assessment of how well a program is performing. Evaluation should always be considered during the planning and implementation stages of a program or activity. Evaluation may be crucial in identifying the health benefits derived, and it can be useful in identifying performance difficulties. In evaluation of control, we can know about the results. In evaluation of disease, we can control the disease, because in evaluation we can know the results of the different programs and different policies which are implemented for prevention or control of diseases. And also we can know about the gap between the program planning and implementation, because sometimes there is a gap between the planning and implementation. We are planned about some programs and we have planned about something, and when we are implementing that we have changes in implementation. So we can know about the changes, or we can know about the gap between the planning and implementation through evaluation. And through evaluation we can know about the feedback of the beneficiaries about different policy and programs, through which we can know about the lacunas of the implementation. And in evaluation of control, we can control of different diseases through the feedback of the patients and through the feedback of the beneficiaries who are suffering from different diseases, and through which we can control different diseases also. And evaluation of control also benefited for know about the performance difficulties, means we can know about which are the difficulties or what are the difficulties we are facing for the control of different diseases from our society. And these are the factors through which we can prevent or we can control of diseases. In this class, we have discussed about the spectrum of disease, the risk groups of disease, the risk factors behind different diseases, and also we had discussed about the iceberg of disease, and we had discussed the control of disease, how we can control of different diseases, or how we can control or prevent different diseases from our society, and what are the factors related with the concept of control of disease. Thank you. Keep watching. Have a great day.